Audio Jungle.
We're going to go over the facts here and the guidance that has come from the NCHS as well as the CDC and how Dr. Fauci, who is completely incompetent at this point, nearly everything this guy has said has been completely off, and he's now made a characterization only a couple of days ago that the death numbers for COVID-19 are not at all in any way exaggerated, and if you think that they are exaggerated, apparently you're a conspiracy theorist, because he's using this very far left language. But let's actually go into the details of the guidance from NCHS as well as the CDC and prove to you the facts that the way these deaths are being categorized are using a very liberal scope for deaths to be defined and certified as COVID-19. Clearly, if you ever take a definition or change it to be a wider, more liberal scope, where you've taken more specific language or terms and you've broadened them, or you've provided leeway or exceptions, you're clearly going to increase the numbers compared to the prior status quo, which is what normally stands for the current rigor with the details of how to certify death for regular daily death certificates that aren't COVID. And now they have actually liberalized this, and you'll even see Dr. Birx will actually justify this assertion. So let's get into some of the details here. So let's read right here. What is the new code? So it provides the code here as U07.1. There's also the World Health Organization has provided a second code, U07.2, for clinical or epidemiological diagnosis of COVID-19 where laboratory confirmation is inconclusive or not available. Now, this is the part. Because laboratory test results are not typically reported on death certificates in the U.S., NCHS, which is the National Center for Health Statistics, you would think they would want more granular, more detailed data whenever possible. But it says they are not planning to implement U07.2 for mortality statistics. And this has an implication for some of the guidance down here of necessarily broadening the scope of finding deaths to be certified as COVID-19, because you're not going to use both codes. You should have both codes. Both codes can tie up to COVID-19, but if you have one that doesn't have a laboratory test, at least you're distinguishing that data. You're putting a marker on that data so that you'll at least be able to report later on, yes, I have 10 deaths, but 7 of them had lab tests because they were U07.1, and I have 3 of them, 30%. You'd be able to do some deeper dives in the data. Very interesting that they are not planning on using this. But when are we going to start doing this? Immediately. So because they're not using this extra code, this secondary code which WHO is provided, it leads to this. Will COVID-19 be the underlying cause? However, the rules for coding and selection of the underlying cause of death are expected to result in COVID-19 being the underlying cause more often than not. Well, that sounds very scientific, doesn't it? Well, they're putting this in here because they're having to address this part. And why is that? Because normally when you're certifying death, the vast majority of time you will have a clinical diagnosis. You'll have an actual fact. And you'll see the fact that they don't use this U07 is providing this very liberal language throughout each one of these paragraphs as we go through them, because once you don't want to distinguish that I'm going to try and report this as COVID-19, but I'm at least going to mark this as without clinical evidence. This is where everything's getting tied into the assertion that these numbers are going to be overblown, and they are. They factually will be overblown because you're now given this type of leeway. So let's continue. What happens if certifiers report terms other than the suggested terms? Now, there's more than one coronavirus, and there has been over the years. So if a death certificate reports coronavirus without identifying a specific strain, or it's explicitly specifying that it is not COVID-19, NCHS will ask the states to follow up. But as long as the phrase used indicates the 2019 coronavirus strain, NCHS expects to assign the new code, which is the COVID-19. However, it is preferable and more straightforward for certifiers to use the standard terminology. So in other words, even if you just have coronavirus, go ahead and let's assign it to COVID-19. So here's another case where even though there could be other coronaviruses, in fact there are, that you're going to automatically assign it to COVID-19. Now, I don't have any doubt it's the COVID-19, considering what's going on in these current months, is probably the case more often than not. But this doesn't mean that there aren't other coronaviruses and other types out there. So this is, again, another liberalization of the use of this term. And here's something that's really, really lovely. What happens if the terms reported on the death certificate indicate uncertainty? If the death certificate reports terms such as probable COVID-19 or likely COVID-19, these terms would be assigned the new ICD code, which means we're going to report them as COVID-19. It is not likely that NCHS will follow up on these cases because, hey, why would we want better data when we're the NCHS? If pending COVID-19 testing is reported on the death certificate, this would be considered a pending record. So it's a pending record. So they can keep a difference, a tag on a piece of data, on a record, that it's a pending record. But they don't want to keep a tag on the data that says it's inconclusive. It seems very selective to me. In this scenario, NCHS would expect to receive an updated record since the code will likely in R99. Here's the thing. If you're putting probable and you're putting likely, is there not a good chance that the reason why you're putting that there, because maybe you don't actually even have the tests, a COVID confirmation test? That might be some of the cases. It could be. And here's the last part. Should COVID-19 be reported on the death certificate only with a confirmed test? Should be reported on the death certificate for all decedents where the disease caused or is assumed to have caused or contributed to death. So this is the lax, beyond liberal scope change that is allowing people, if as long as they're dying, maybe we could put them down as COVID-19. As long as I assumed, or even if it contributed to the death, you're putting them down as COVID-19. They are being listed as COVID-19 deaths, and the way they are characterized in our media and the politicians and from that fraud Fauci is that people have died from it. Of course, there's always a difference between dying from a disease or dying with a disease or with any type of ailment. This is just unbelievable. It's very clear that this is completely skewed towards overinflating the numbers. We're going to include as many people as possible, and we're going to overshoot the target. I mean, this is quite clear. You can't expand a definition and liberalize it in a way that's different and opposing more restrictive definitions in the past, and then not tell me, and not tell me that this isn't going to expand the net and that which is catched. It doesn't make any sense. It's not plausible. And the other thing here is, if the decedent had other chronic conditions, such as COPD or asthma, congenital heart disease. I mean, we're talking about diseases that someone's could have for years, and especially being older, getting weaker and weaker and weaker. These conditions can be reported in Part 2 of the death certificate. You'll see the Part 2 part of the death certificate is just that. It's the second part. The first part is really indicating the cause, and Part 2 is merely the notation of other factors that might have been going on with that patient. But as reported in Italy, 98% of their deaths, they said, had cofactors of serious health issues, along with many of them, of course, being elderly. And this is interesting because here is the vital statistics, the NVSS, and now this is from April. What we just read before was from March. Part 1 of the death certificate. This section on the death certificate is for reporting the sequence of conditions that led directly to death. This means literally the cause. So, as you just saw in the other document that they had, despite having a long history of asthma or diabetes or COPD or CHD, those will now become secondary. Okay, so now Part 2. If COVID-19 played a role in the death, this condition should be specified on the death certificate. But we've already seen that they want it as the cause, they want it in Part 1. So they're basically saying, well, they're saying if you've died with it, you've died from it. And that is not true. That can't be true in every single case. And part of the reason why that can't be true is if you're already admitting you're going to accept some as COVID-19 without a clinical diagnosis, just on a hunch. This is absurd. This part's really boggling. Boggles the mind. An accurate count of the number of deaths due to COVID-19 infection, which depends in part on proper death certification, totally agree, is critical to ongoing public health surveillance and response. When a death is due to COVID-19, it is likely the U code, and thus it should be reported on the lowest line used in Part 1 of the death certificate. Ideally, testing for COVID-19 should be conducted. Ideally. Oh, please. But it is acceptable to report COVID-19 on a death certificate without this confirmation. We're talking about clinical diagnosis, if the circumstances are compelling within a reasonable degree of certainty. So they're saying proper death certification is critical to ongoing public health surveillance, which of course is true, but yet they've completely liberalized this across the board for COVID-19.
Other countries that if you had a pre-existing condition, and let's say the virus caused you to go to the ICU and then have a heart or kidney problem, some countries are recording that as a heart issue or a kidney issue and not a COVID-19 death. If someone dies with COVID-19, we are counting that.
Okay, so there you have it. And all she's doing is actually, for once, a government officials confirming the truth and the facts is that they've liberalized this, and if you die with it, we're going to report you as dying from it. Clearly this is an expansion. There's no other way of dealing with this other than you're going to get larger numbers of COVID-19 reported certified deaths than if you had used the traditional way that they would categorize anybody else dying from anything else for any other reason in the country. So they've made a nice special case for COVID-19. Here's some more details. Let's watch this video.
My next guest is a doctor and state senator in Minnesota who is deeply troubled by the CDC's latest guidance for counting COVID deaths. Dr. Scott Jensen joins me now. Doctor, I want to read for our viewers what the CDC says in part about how to count COVID deaths relating to that last issue we just raised. In cases where a definite diagnosis of COVID cannot be made, but is suspected or likely, like the circumstances are compelling with a reasonable degree of certainty, it is acceptable to report COVID-19 on a death certificate as probable or presumed. So, doctor, what's the problem with that?
Well, in short, it's ridiculous. I spent some time earlier today just going through the CDC's manual on how to complete death certificates and the parts that were specifically written for physicians. And in that manual, it talks of precision and specificity, and that's what we were trained with. The determination of the cause of death is a big deal. It has impact on estate planning. It has impact on future generations. And the idea that we're going to allow people to massage and sort of game the numbers is a real issue, because we're going to undermine the trust. And right now, as we see politicians doing things that aren't necessarily motivated on fact and science, the public's their trust in politicians is already wearing thin.
And doctor, in that same CDC guidance sheet on COVID-19, it references the fact that basically this is a judgment call for doctors on how to fit, and I read it, what goes on line 1, and then what goes on line 2, and what goes on the final line as far as contributing factors and the ultimate cause of death. But they concede that it is a judgment call. Again, why is that not correct?
Well, let's just take influenza. If I have a patient died a month ago, had fever, cough, and died after 3 days, and maybe had been an elderly, fragile individual, and there happened to be an influenza epidemic around our community, I wouldn't put influenza on the death certificate, and I've never been encouraged to do so. I would put probably respiratory arrest would be the top line, and the underlying cause of disease would be pneumonia, and in the contributing factors I might well put emphysema or congestive heart failure. But I would never put influenza down as the underlying cause of death, and yet that's what we're being asked to do here.
Dr. Fauci was asked about the COVID death count today. Here's what he said in part.
What do you say to those folks who are making the claim without really any evidence that these deaths are being padded, that the number of COVID-19 deaths are being padded?
You will always have conspiracy theories when you have very challenging public health crises. They are nothing but distractions.
Conspiracy theories, doctor? So you're engaging in conspiracy theories. What do you say to Dr. Fauci tonight?
Well, I would remind him that anytime healthcare intersects with dollars, it gets awkward. Right now, Medicare has determined that if you have a COVID-19 admission to the hospital, you'll get paid $13,000. If that COVID-19 patient goes on a ventilator, you get $39,000, 3 times as much. Nobody can tell me after 35 years in the world of medicine that sometimes those kinds of things impact on what we do. Some physicians really have a bent towards public health, and they will put down influenza or whatever because that's their preference. I try to stay very specific, very precise. If I know I've got pneumonia, that's what's going on the death certificate. I'm not going to add stuff just because it's convenient. I think that it's not a conspiracy theory at all.
Yeah. So you reject what he said?
Absolutely.
Okay. This guy, not this guy, but Dr. Fauci is a complete fraud. And I don't know, is he perhaps probably a liar? How can he not know the expansion of the scope of what is now considered COVID-19 and how that is different than your general course of certifying death for death certificates? I mean, he's either incompetent or he's literally lying. Where is this conspiracy? He's actually pushing a conspiracy theory that the numbers are not inflated. And this goes from, this is from the Guardian, the far left Guardian, working, of course, who are very much in favor of this, of death and destruction as far as relates to COVID-19. Anything that could be more damaging or dangerous or works against the entire public is something that they push, and they're actually relishing in anything that's type of destruction of Western civilization. But let's go into this. This is where he says, actually, quote, "There is absolutely no evidence," end quote, "of claims of coronavirus overcount pushed by right-wing media." I guess Dr. Birx is right-wing media. And so is the CDC and the HVSS are part of the vast conspiracy of the right-wing media. Dr. Fauci is a complete fraud. I don't know if he's incompetent or if he's lying. It might actually be both. We just proved the liberalization of this. There's no way that you can't tell me that you're not expanding the scope of COVID-19, and you don't even use the second code provided by WHO for those cases where there might be suspect or where you don't have a clinical diagnosis. It's clearly stating without even a clinical diagnosis, as long as you suspect, you can put that down as the cause. And Dr. Birx also confirmed that if you're dying with it, we're basically going to put you down in part 1 of the death certificate, which means we are saying you're dying from it. Because if you read the guidelines on what part 1 is, part 1 of a death certificate is what has caused your death. So this guy's a fraud. He needs to be fired. Dr. Ron Paul has talked about this too. This guy is incompetent, and he absolutely loves putting his face wherever he can right now after being a complete nobody for 36 years. And he's literally endangering lives and livelihoods to literally the tens of millions here, because this moron has even been on the record there saying nobody shall leave the frigging house until the very last infected person is no longer infected or is better and healed from having this. This guy's a complete lunatic. He needs to go. And here's the last little bit here. Just quoting Dr. Birx, which we didn't get out of the video. One thing here is a quote from an epidemiologist and director of the Center for Evidence-Based Medicine at the University of Oxford. Quote, "We know during an epidemic, people will call every death as though it's related to COVID-19, but that is not the case. Always when people look back at the case notes and assign causation, but never mind that they already admitted they're not going to go back. HVSS and CDC already said they're not going to go back and look at the death certificates. But anyway, he says when they look back at the case notes and assign causation, they realize they will have overestimated the case fatality in relation to the disease," end quote. Furthermore, next from Dr. Deborah Birx, after explaining that the approach to reporting COVID-19 deaths in the U.S. is quote-unquote very liberal, yeah, maybe that's with a capital L, Dr. Birx notes that, quote, "If someone dies with COVID-19, we are counting that as a COVID-19 death," end quote. This is nuts. This is total BS. It's total BS to say that these numbers aren't going to be exaggerated. Of course they're going to be exaggerated. Are they exaggerated by 2% or 20%? Well, we don't know, and it doesn't really seem like they want you to know either, right? Because otherwise, again, they could have had that second code that was offered, that ICD code, that would have been a flag on any COVID-19 reported coded deaths, so that they could distinguish this later on. Maybe go back and actually look at that. But no, the Health Center for Vital Statistics doesn't want to do that. Why would they not want to do that when that's their job, is to deal with statistics? This is completely a joke. But the big thing here is this liar, Dr. Fauci, is a liar, or he's an incompetent and doesn't know what the hell's even going on. This is clearly, first of all, Dr. Birx is contradicting him, and she's actually for once, someone's being accurate, and she didn't even mix words here. She flat out told us that the numbers were going to be. Indirectly, she told us the numbers are going to be higher. Well, obviously, they're going to be higher if you're reporting it that way. So for someone to deny that, that person's a conspiracy theorist, and Dr. Fauci needs to be fired. He's a fraud.